Are a future nurse, these are the ethical responsibilities that you need to know before taking your NCLEX and entering the healthcare field as a novice nurse. Feel free to take a screenshot of this. We're going to start off with autonomy, which is the client's right to make their own decision. No matter what the client states they want to do, whether they want to move forward with a procedure or not, they want to take a medication or not, as long as the client understands the benefits and the risks associated with that intervention and not doing it, you have to respect their decision. Beneficence is the obligation to do good. Now, I take the B in beneficence and I always remember be good. A way that you may see this on the NCLEX is an RN's ability to appropriately assess and manage a client's pain. Next, we have fidelity, which is the obligation to be faithful to your responsibilities, to be trustworthy, uphold your confidentiality, and keep promises. So if a client has specific HIPAA contacts on their chart and you promise that you're going to follow through with them with the patient's condition, you must follow through, call them, and notify them of the patient's condition as long as they are HIPAA-approved clients or individuals. Non-maleficence is the obligation to do no harm, so it's the intention to not cause unnecessary harm or suffering. A huge way that you can see this on the NCLEX is administering appropriate medications. So for example, administering the correct dose through the correct route. Next, we have justice, which is the obligation to be fair to all individuals. So it's the same quality of care for all of your clients. Next is veracity, which is the obligation to state the truth. Now, this is providing accurate and truthful information to allow for appropriate, informed decision making. So for example, if a client is about to go into surgery and the surgeon walks into the room to obtain informed consent, first off, you need to be present as a witness. And second off, you need to make sure that all of the information is being provided to the client, that they understand the risks and the benefits so that they can appropriately make a decision whether they want to proceed with this or not. And lastly is confidentiality. This is both a legal and an ethical obligation to keep information private. So we do not share client information with people outside of the healthcare team, and we do not share client information with people who are not designated as contacts by the client. A common example of this is if you overhear somebody talking about a client in an elevator, or you accidentally tell somebody who is not approved on the patient's HIPAA contacts. I know that these are very tedious and sometimes you feel like you're not tested on them, but these are the foundational principles of nursing care. Don't forget to follow for more.